Blynyddol heddiw. Welcome to our annual general meeting. It's hot, so make sure you keep yourself hydrated during this meeting, please. And we've got a significant number of people who are speaking today or are visiting. So I welcome Rhiannon Beckett, our Interim Director of Finance, Seb Phillips, who will be commencing his role as Director of Finance, Planning and Performance in August. Welcome, Seb. Alex Aubrey, Clinical Lead for Artificial Intelligence. Lisa Bassett, Programme Manager for Urgent and Emergency Care. I've also got Angie Oliver, who is online, who's our Deputy Director of Workforce and Organisation. And I've also got Joanne Davis, Strategic Programme Manager, and Victoria Whitbread, Primary Care Clinical Lead, in attendance to support the presentation of the agenda item 5.3, and Ellen Jones, Pharmacy Dean, in attendance to present the agenda item 5.4. All right, you are all very welcome, and if I've forgotten anybody, I do apologise. Okay, the annual report is the main piece, with a presentation from our Chief Executive and our Director of Finance overview. And then I will be asking to receive and approve the annual report. So, over to you, Chief Executive.
Diolch, Bore da pawb. So if we move on to the first slide, this just provides an overview of the achievements that are outlined in the annual report, which are all designed to help us deliver on our key purpose, which is to develop a sustainable and motivated workforce, working with partners that helps to deliver improved care for patients and improved population health. So what you'll see from this slide is that we are more than only education and training, although that is clearly an important part of our functions. We deal with and progress a number of other broad-ranging initiatives as well. And overall, last year, it was a good year in terms of progress against the objectives that are outlined in our integrated medium-term plan, and a number of those will feature in the showcase later on, so I'm not going to steal the thunder of colleagues who are eagerly waiting to present on those things. A few things just to pick up on as part of this. So, for example, the All Wales Retention Programme, which we'd established for an 18-month to 2-year period, that came to conclusion in 25-26. That clearly contributed to an improvement in turnover across Wales, which has been sustained over recent months. And we are now evaluating that programme to identify if there is further work that we need to do to target retention initiatives at specific locations or services. We also continue to work closely in the light green box with our colleagues in a number of national programmes that span the whole of NHS Wales. So, for example, in relation to planned care, urgent and emergency care, and we were able to also support some clinical networks like the Women's Clinical Network with the development of education resources for the new women's hubs that were launched last year. We concentrated again on really improving and supporting colleagues in developing workforce planning through the improvements in workforce data, modelling and insights that are available, but also how we've been supporting people in applying that at a local level through a focus on workforce planning. So if we move on to the next slide, as a strategic organisation, not everything that was in our MTP last year was a one-year only initiative, and there were a number of things that we started last year that we will be building on as we go into 26-27. Clearly, primary care is a hugely important agenda, and the Welsh Government's Community by Design programme is something that we are absolutely playing a pivotal role in. And so one of the things that we've done within HIW is to really improve the focus and visibility of all things primary care through a new deanery that brings together the work from the workforce plan, the primary care academies, and the extensive training activities we do for our primary care workforce. We've also started work on an education strategy, and this seems to be more and more important as we understand the context really for the future of our education system in NHS Wales and in Wales more broadly, thinking about the position of our higher education institutions and also further education. And that work will come to a conclusion during the course of this year and really set the direction for the first time as to where we need to be going from a health perspective over the next 5 to 10 years. Also continue to participate in the development of the UK Leadership and Management Framework. We've been waiting for quite a while for that to be officially launched, and that has now happened. So again, the foundation work that we did last year, we will be building on going into this year, working closely with the new government to establish how we're going to roll that out in NHS Wales and recognise and value the important people at all levels that are doing those managerial and leadership roles and provide them the right tools to do their best work. And then lastly, just to mention the continued development of the NHS Wales staff survey. So in the last year, we saw a significant improvement in response rates across Wales from just under 22% to 30%, which was a step change. Improved, however, is still not where we need to be in terms of response rates. And if we look across the board, we know that NHS England are achieving 49%. So that data is starting to be used and focused on in national conversations. And what we really need to make sure is that that becomes even more representative of staff feedback as we go forward. So if we move on to the next slide. Obviously, last year was not without a number of risks and issues that are really, really important that we recognise here at the AGM. And the most important one, I think, is the challenge around graduate employment, which started to emerge last summer, particularly around paramedicine, but developed through the year. And obviously, we are still dealing with that as an issue as we speak. From a HIW perspective, our commitment is to make sure we do everything possible to work with colleagues across the NHS and with professional bodies and with universities to secure employment for all of those students who want to work in NHS Wales. And we are really pleased with the approach from the new government in setting up a graduate summit in June, which we are now taking forward the actions that were agreed as a system to really support that transition into employment. And that continues to be a very live piece of work, occupying a number of people, not just around this table in our organisation, but also, I know, across health boards and trusts across Wales. On a similar vein, we've also had to deal with issues around our medical associate practitioner colleagues in the light of the Leng review. That process is being overseen by Welsh Government, and we are participating in that. That has meant a pause, if you like, on how we take forward, particularly physicians associates in Wales. And again, our commitment as an organisation is to really work with those people who are already in the system, see how we can support them going forward. And again, on medical recruitment and education, which is driven very much on a UK level, and a number of changes this year, which again, we've had to really assess in a very live way to see whether that was going to impact on us in terms of fill rates and bottlenecks in recruitment. And that will continue to be an issue that we monitor during this year. I should also mention digital, because clearly digital is key to the way that we take forward our work in HIW, not just in terms of data, but also in terms of the digital platforms that enable access to education and training, and also digital skills and capability. And as with most organisations across the NHS, our capacity there is in short supply, and we have to prioritise continually to make sure that we are supporting the right priorities for the organisation. So if we move on to the next slide, obviously we have achieved all of this with the support of our professional, dedicated and enthusiastic workforce. And this slide just gives you a few key statistics around our current workforce. So having gone through quite a period of growth, we have remained at around a relatively stable headcount over the last 2 years, at just less than 500 full-time equivalents. And we've also seen good indicators in terms of our statutory mandatory training, our sickness, etc. I would really call attention to our staff survey internally, where we had a response rate of 93%, which is really excellent and gives us a very granular insight to the issues within the organisation. Obviously, having an engagement score of 78% is positive, but we always look at the areas where we see issues arising in terms of a focus for improvement, because clearly we can't be complacent with a good response rate and engagement score. We have to all the time be testing and challenging how we make things better for our workforce so that they can do their best work. And we have developed a workforce plan this year, which will also provide really the guardrails for how we develop our workforce going forward. And then finally, just looking ahead to the current year, clearly implementing our IMTP will be at the core of our activities, and the education and training plan that Welsh Government agreed in February this year. As everybody will know, that was based within a very difficult financial context on very much maintaining investment but not increasing investment. And that has also brought some risks along the way in terms of our university partners. And if we look at the longer term, then we need to really keep an eye on that really important pipeline for our future workforce supply in coming years. But clearly we would recognise as an organisation the overall financial context affecting not just the NHS in Wales, but the whole of Welsh Government currently. And then you can see some of the priorities that we've got there in the green box for development as we go through the year, a number of which I've already mentioned. Obviously this issue of looking at graduate supply and employment will continue to be a big piece of work, using the data that we've now got to plan ahead and to ensure that the issues that we've seen in the last 12 months are addressed as we go forward through better workforce planning and modelling for the future. So I'd just like to finish by thanking all of the partners that worked closely with us during the year on all of these initiatives. Clearly, most of them are Once for Wales national things, which really require engagement right across the board, particularly our stakeholder reference group. I'd like to thank the board for all of their support. And I'd also just like to thank the chair in his last annual general meeting for absolutely keeping us on our toes, making sure that we have got an ambitious vision and really being incredibly supportive to us as a board, us as an executive team and all of the staff within HAW. So thank you very much.
Checks in the force then. Right. Okay. Thank you, Alex. I'm going to ask Rhiannon now, as our Director of Finance, to give the overview, please.
Thank you, dear. Slide, yeah. So it's pleasing to note our delivery against the financial targets for 25-26. So as our statutory duty as a health authority is to ensure that our expenditure does not exceed the total revenue or capital resource funding available to us in the financial year. And we reported a small surplus of 530,000 for 25-26 against a total revenue resource limit that was 384.5 million. So achieving a break-even position at year end. We also reported a small surplus against the capital allocation, which is just under 1.7 million. And a small surplus of 58,000 against our capital allocation. We were also able to achieve the Welsh Government public sector payment policy target of paying at least 95% of all our non-NHS creditors within 30 days of invoice, achieving a 97.6% achievement against that. And that is the whole organisation working to make sure that those invoices are processed and those payments are made on time. Next slide, please. So this just gives an overview of the expenditure between sort of the years of 24-25 and 25-26. So that's at quite a high level, but it's just to illustrate some of the reasons for those increases. So we've seen an increase in our student training fees payable to universities in our healthcare professional education and training budgets. This is because of an increase in the numbers taken out of the bursary package, but also because our tuition fee increase took place during 25-26, with fees going from £9,000 to £9,535. We also saw a small increase in the average bursary award. So bursary is means tested, and there was a slightly higher average award made during the year. We've also seen an increase in our student salary reimbursements to help boards and other organisations, which means more people are able to take up the offer of training courses whilst they're in work. For postgraduate medical, dental and pharmacy, we've got an increase in our training grade salary expenditure, predominantly due to pay award for our resident doctor population. Got an increase in the numbers in our dental foundation training, and higher fill rates across our pharmacy programmes are also contributing to that commissioning expenditure increase. In terms of non-pay, largely these are inflationary increases across our non-pay budgets. And then for pay, although we've got a really stable workforce, there's very small number of increases in the year. There was an increase in the national insurance average rate, and pay award is also impacting and leading to an increase in expenditure there. Thank you. So this slide shows the revenue funding available to HAW in the years since the organisation was established, and there's a significant increase, as you can see, between our revenue funding from 2019-20 to 25-26, and that shows the 384.6 million. We are continually striving to be able to evidence the impact that we have across the system. We know that we have a return on investment for a nursing graduate of around 13 months. So there is a saving in creating that sustainable workforce into the future. And also with specialty training doctors, that we believe that is less than 3 years in service before they paid back the investment in that training. And obviously they contribute to the quality of care and a sustainable workforce into the future. As I said, we're always trying to look at ways in which we can evidence and demonstrate the impact that we make and the value for money of the programmes that we run. So we are working across finance planning and our data and digital teams to improve the data available and make sure that we're able to bring the people in our training programmes through into employment, so we can, I suppose, really evidence that first destination and that sort of sustainable training pipeline into the future. There have been a number of training dashboards developed during the year, and workforce intelligence that we are now able to utilise and model into the future will help us be able to commission more efficiently and effectively, and as I said, support that sustainable workforce model into the future. From me, thank you.
Thank you, Fiona. The next item on our agenda, item 2.3, is to receive and approve the annual report. Are you doing this, Alex?
I think I just need to ask them to receive and approve it.
Will you receive and approve it?
Yes.
Thank you very much.
So just in completing that section, just to recognise that although Glyn is not here, also to thank him for his contribution during the year and for supporting us get into the end year position that Rhiannon has helpfully outlined.
So then, a really important report and reflection really on our annual quality report. And Sam, you're covering this?
Yes, I am.
As our director of nursing.
Thank you, Diolch. For our colleagues, I'm just going to talk to you about our second annual quality report, which we'll be submitting shortly. So this report is anchored on 4 of these quality ambitions, so that we continue to embed the duty of quality, as all WELS organisations do within our organisational culture. We continue to develop our quality management system, which is well established within education and training, but looking to support how we establish that further within the whole organisation. About strengthening how we listen and respond to the learner voices that move through our programmes, and also that we improve our quality reporting processes. So for the report, we've just picked out a couple of slides of some highlights of success where we feel we're really achieving the duty of quality standards within the organisation. And some of these cut across some of the other work that's been reported today, so I'll just pick out a few. One of the established groups is the Quality Oversight Group, which has been really strengthening the governance and collaboration that we have across the organisation, where we synthesise intelligence, we look at thematic learning, we work with other partners such as Health Improvement Wales, the regulators, the universities, and really bring in the intelligence that we're hearing from out in practice, and look at whether we need to respond, whether we need to act, or whether we need to report on that. And then we bring that learning within the Education and Quality Committee so that we've got clear sight of the governance and assurance around the learning across the organisation. And as you can all appreciate, service change is at pace at times, and so we need to keep fleet and be agile, and that group's enabling us to do that. There's been quite considerable rollout about quality improvement understanding across the organisation this year, and we did have a lead role from my director that led on the duty of quality. That was Maria, who left at Christmas, and really supported everyone's understanding about what quality means, the STEEP principles, and why this is important. Reinstated the National Student Forum, and also I've had the privilege of being at 2 boards where we've listened to the learner's voice. And actually that's a really powerful way of us understanding their lived experience, what it's like to be in their shoes, and really bringing that kind of practice and policy to the front door of the building. And then, as alluded to a few times, and furthermore, is our Workforce Oversight Group, which has been really timely and has given us an excellent interface with our health board and strategic health authority colleagues to support how we use our much improved data to bring workforce planning to the fore and make it everybody's business. It's been slightly hijacked with the graduate supply challenge, but actually it's been a great way of testing how we work together collegially to look at that. Then on the next slide, I wanted just to highlight about the placement capacity work that Ian's team have worked really hard to do. We've now got many more placements within primary care, and I've just come off a call with the Nursing Midwifery Council, who called Wales exemplary, and they're using Wales as an example of how midwifery graduates have their last placement becomes their first destination post, and how they look to roll that out across the other 4 countries. So some really good work around placements and increasing capacity. Tidusky, the bilingual national learning system. I keep getting lost in it. It's a treasure trove of stuff, which is fantastic, but also it allows us to keep us live and quality assured in regards to the work that we have done and the programmes that we offer. Tied in with the CPD strategic framework, we'll be looking at how we make sure that all of that learning is contemporary, current, and delivered in the most agile fashion. And the Workforce Planning Hub, I think, can't underestimate the visits and how that's enabled people to feel more confident and competent in how they're planning their workforce locally at source. Like everything, we've had challenges in regards to quality. Some of those, as Alex recognised, are beyond the power of us, but the higher education institutions are feeling quite brittle at the moment in regards to reduction in commissioning, but also the business side of finance for them. We, of course, have got our work around graduates to make sure that we keep calm and that we do not just panic the system as we work through this regime. The implementation of the prioritising HMF, postgraduate medical recruitment. I should have got you to say that, Tom. And also we have got a lot in the MapNeo space in services. So we've got national reports in Wales, the Pathways report. We've got the UK reports in regards to AMOS and Ockenden. And we have got highly precious services where we've got learners within that. So they bring us challenges all the time. But we're looking forward to the year ahead to continue enhancing the learner's voice and engagement with our learners. We have reached out to the graduates and had quite a lot of interfaces with those during this time. Ian's team has with the paramedics. So actually us being people, not just a body, who was they refer to. And also working hard to look at how we evaluate the impact of our programmes with the quality then. That's just some highlights, thank you, Chair.
Thank you, Sam. Thank you for that overview. We're now going to the bit which is always a bit, questions from people who are from outside of this meeting. And we have how many?
Two came in yesterday.
Right. Okay, off you go then. Let's have the first one.
First question is, recognising that supervision is critical for workforce development and support patient safety and assurance, what are AGI's plans to provide training in supervision for supervisees and supervisors across professions in Wales?
Yeah, that sounds more in your field than Tom.
Yes, I'm happy to start. So we absolutely recognise the critical role that effective supervision plays in workforce development, staff wellbeing and patient safety. We actually provide a range of supervision resources, education and support across a range of professions. That includes the HEIW Supervision Hub, the preceptorship programmes we support, and the support delivered through our network of practice education facilitators that form a really tight community of practice. We are also strengthening our multi-professional approach through the development of new guidance to support supervisors and supervisees, and that's due for launch imminently. And it remains an area of ongoing development, working with health boards, universities, professional groups to ensure high quality supervision across Wales. So there's a lot of work takes place in that really important area.
Tom, do you want to add?
Yeah, okay, yes. I think Ian signposting people to the Supervision Hub and the resources that we're developing there is really important across all our professional areas. And I think it's recognising our role as an organisation is to provide that national guidance, the learning resources for individual development in those roles, but also to work very closely with those organisations, as Ian alluded to, because it's really important that employers, managers understand the importance of supervision for their workforce, provide time for individuals to do this properly, and that we provide that central resource to avoid duplication of effort in that area. So signposting to the supervisor hub that we have, where that resource is being developed, continues to be developed, and that multi-professional supervision guide that will be joining that hub in the next week or so after approval this week, I think will be very valuable resources for our colleagues out there.
Thank you. Second question.
Second question. There are clear indicators for further expansion of the speech and language therapist workforce in Wales, and yet university places are declining. Is there an intention to reverse this decision?
Yes,
Me again, yeah. So we absolutely recognise the workforce challenges and growing demands around speech and language therapy and a range of other disciplines that's highlighted in national workforce evidence. Decisions in commission training places are informed by a range of factors, including workforce demand, service requirements, available funding, in discussions with NHS Wales, employers and education providers. The commission levels for 26-27 remain within the contracted range for universities, and future commission decisions will continue to be informed by workforce intelligence and the available resourcing.
Yeah, and I think it's a really good question, isn't it? Because it does really get to the heart of where we are in the short term versus where we might want to be in the long term, and how we recognise financial constraints, availability of roles in the short term versus what service models we aspire to in the future, focus on prevention, focus on primary and community. And I think currently we're probably in a phase where that's not all agreed as a strategy yet, but there is obviously an intention by the new government to develop a longer term approach to workforce planning and the workforce strategy. We've just started conversations with them about what that might mean. And that will be something that they're keen to put the first stake in the ground in the autumn. And for us in HIW, I think that's a really good opportunity because, you know, the education and training planning cycle, even though it's 3 to 4 years, it's still probably not long enough for us to really have a good think about what's the workforce we need for the future. So I think, you know, we understand the spirit of that question and absolutely look forward to having that longer ranged approach as we go forward.
Okay. I've not been made aware of any other written questions that have come in. And so should we do the showcase? This is the so really interesting. This session is about the future of Dyfodol, right? It's looking forward. It's not retrospective. So preparing our people, our staff who work in the NHS to the challenges that will come and the opportunities to provide great care is what we're all about, really. So, and luckily, healthcare is changing rapidly. I mean, I say luckily because we need to be taking every advantage that technologies and what research is out there. So HEIW has a unique role in ensuring the workforce has the skills, knowledge and confidence to build on. So today our story has 3 connected parts. The first part, we'll explore how HEIW is using artificial intelligence to transform education through trusted AI mentors, providing personalized learning that is accessible to staff wherever they need it. So that sounds cool, doesn't it? Then we'll then go on to how our strategic mental health workforce plan is delivering real improvements for patients, services, and the staff across Wales. And then finally, we'll hear how independent prescribing is extending professional roles, improving access to care, and supporting more sustainable services. So together, these presentations, I hope, will demonstrate how investing in education, innovation, and workforce development is helping to strengthen the NHS Wales, improve patient care, and ensure sustainability for the future. So, shall we begin with a bit I find frightening and interesting, which is AI and how it has the potential to transform learning across the NHS in Wales. And this is over to you, Alex and Lisa, and I'll very kindly give you a 5-minute warning, all right?
Thanks for the introduction. Yeah, so my name's Alex Wilber. I'm the clinical leads for artificial intelligence here. I'm also a practicing GP up in Merthyr. And I was brought into role back in 2024, March 2024. And the kind of, to surmise what I was asked to do was to try and work out where Wales was in terms of its AI literacy level at the time, in terms of the NHS Wales workforce. And depending on what we found, try and create some sort of educational strategy and resources to try and upskill the workforce. As part of the landscape review, it was a big piece of work. We spoke to stakeholders and area kind of thought leaders across the UK. But one of the most interesting things that I've relayed that we found is we conducted some research at the Royal College of Nursing conference in Cardiff in summer 2024, asking various questions around artificial intelligence, and the answer, it was almost unanimously negative. No, we don't think it'll improve patients. No, we don't think it'll help us. All very, very negative, very sobering. There was one question we asked, which was overwhelmingly positive, which was, real music to our ears, which was, would you like to learn more? So despite everybody saying, no, we don't think it's necessarily the panacea and it's not going to be this kind of quick fix, yes, we do want to learn more. So that was really good news to us, because it showed we don't have a reluctant workforce. We're not dealing with a reluctant workforce. We're dealing with a workforce that's perhaps cautious and rightly so about the potential changes that are afoot through artificial intelligence and some of the digital solutions. To again, a big piece of work, but to kind of, in summary, what we found with the landscape review is that, and our training needs analysis, is that people want personalised, tailored and bite-sized education to help them upskill and improve their AI literacy as we move into this new world. And this can't come soon enough. To give the latest figures, this number has been changing every time I talk on this. It's now 1 in 4 GPs, is the latest number, are using artificial intelligence in their clinical work day to day. And that can be things like ambient voice technologies, which are medical devices that are used to give a summary of a clinical encounter and help with a clinical record, but also perhaps more concerningly, web-based large language model chatbots like ChatGPT and Copilot and various others. At HIW, as a result of all this, we thought, well, let's get our own house in order first. So the first thing we did, and we were really very early to the party with this, was we created some safeguarding documents, so a safeguarding AI practices and a prompt engineering document internally, so that our own staff could understand the potential pitfalls, the benefits for artificial intelligence, how to get the most out of it, but also how to use it as safely, responsibly, and ethically as possible. Clearly, that wasn't enough. We needed to do something for the whole workforce in Wales. When I started, a classic doctor, it was all very doctor-centric, and I was reminded very quickly by my boss, Craig, that that was not good enough. So then physios and nursing colleagues, pharmacists, and then I was reminded by Sean, Craig's boss, well, what about the clerical and administrative side of the NHS, which is clearly a significant chunk of the workforce? So I kind of sat back in the chair and thought, well, this is ridiculous. Over 300 roles in the NHS in Wales. How can I create educational material that's going to be appropriate and applicable and useful for such a wide variety of specialisms and roles? And we know the graph on the right is demonstrating Bloom's two sigma problem, which tells us that if you are in a one-to-one cohort, if you're taught in a one-to-one setting, you will perform in the top 2 to 3% of a group-led cohort, just by default, because you've had one-to-one tuition. And the team and me and myself kind of came up with this idea, well, how can we integrate all these things that we're learning? And we had the brainwave to use AI to learn AI. So we could actually use artificial intelligence to join up and fill in the gaps for the resource documents that we were able to find. Next slide, please. And that led us to HALI. So HALI is the Healthcare AI Learning Interface. And it's running on the screen as we see now. So I'll just quickly talk through this kind of user experience here. All you have to do is say what your role is. And this person has said they're a nurse. It might be a pharmacist, a finance director. It could be anything within the NHS. And the chatbot will then ask you, well, what specific type of nurse? Because clearly, if you're an infectious disease nurse versus a mental health nurse, in this case, the implications for artificial intelligence could be quite different. It then asks you which persona or archetype you identify with: shaper, driver, creator, embedder, or user, which is borrowed from NHS England, some really good work they did actually before the advent of these large language models. And then also, how would you rate your familiarity? Are you a novice, intermediate, or advanced user? And after that, the model will then tell you about how AI might apply in your role, focusing very much on the risks and the challenges, but also giving the user an opportunity to explore the opportunities and benefits that artificial intelligence can offer to them in their role, clerical and administrative or clinical, and indeed, in the long run, benefits to patients. So the answers, this is very important, and a huge amount of work went into making sure that the answers are grounded in NHS kind of authenticated material. And the user actually also has clickable citations for that material. So they can go to the source document, the raw document, from which our model is giving its answers, and they can go off and read in specific documents the areas to ensure it's absolutely trusted material. So we think that this can help us potentially look at solving some of the future NHS problems that, which are absolutely are surmountable, but are numerous in this difficult time. So to finish, what we feel Halley is doing, and our AI mentors, is actually allowing improvement of AI literacy at scale across the workforce without leaving anyone out or anyone behind. Safe adoption of AI when they do start adopting it, but also it fosters this culture of curiosity and innovation, which is, in my opinion, certainly something we're going to need moving into this new world with digital solutions in healthcare. And I won't make an apology for the lack of humility here, but we've presented this across the 4 nations, and the feedback has been really extremely positive. I would go as far as to say we are 4 nations leading on this, and certainly are pushing the vanguard really for what is achievable. And we've got multiple other use cases and multiple further ideas to build on from here. When we spoke to other teams about other use cases, absolutely the first team that came to us and with an excellent use case was the genomics team. So I'd like to pass on to Lisa, who's going to tell you about their idea and their application of this technology, to give you an idea of how it can apply across the workforce in different areas.
Hi, thanks. I'm Lisa Bassett. I'm the Programme Manager for Genomics here in HCIW. And as Alex just mentioned, Halley came along at just the right time for us in genomics. As part of the Genomics Workforce Plan, we'll be developing the Genomic Capability Framework, which is for the wider workforce across NHS Wales to improve the genomic literacy. So as we know, you often see it out in the news every day, genomics, there's an increasing demands for knowledge around the space around genomics and advanced therapies. Downside to that is there's also an increasing wealth of education out there as well, and it can be difficult to navigate for our workforce when they're short on time as it is, so they often don't know where to start. And actually that has come through the engagements and awareness sessions that we're running with staff, that often they struggle to understand how genomics is applicable to them in their specific role, the service area they're working in, but also obviously to the patients that they're seeing as well. So as we've developed the Genomic Capability Framework, we've managed to expand that offer by utilising the AI mentor of Gwen, which is genomics, small W wider, big W workforce educator, education navigator. So similar to Halley, and it'll show it now on screen of how you use it and the examples it'll give out. But this provides that personalised learning support that we were keen to adopt as part of the capability framework. Genomics is all around personalised medicine, so we wanted to ensure that we took a personalised learning approach to it as well. So it allows users to work through sort of real world scenarios of patients that they may see during their day-to-day practice, and allows them to build understanding in the context of, like I say, their day-to-day practice, specifically to them and those that they'll see, advise and treat. As Alex has already mentioned, we've had lots of engagement around this as well from our colleagues across the UK. So it's really positioning HIW as a lead in AI-enabled workforce education, and really is a prototype for other areas to build on as well. I know Alex has mentioned already that we're looking to expand it further in HIW. The next steps for us is only launched 2 weeks ago, so obviously we'll be gaining some data and feedback on that, but we're already planning our phase 2, and this will include at the moment, it's really around human genomics. We're keen to include pathogen genomics as well, so that's infectious diseases. We know that and healthcare associated infections, the impact it can have on our services and specifically our patients. So we've been looking to roll out pathogen genomics now in the autumn, along with advanced therapies and something around sort of prenatal and screening as well. And we'll be launching that during Genomic Literacy Week in November. I'm sorry, I'm really hoarse today, typical.
I do apologise that my phone went off. I think you coped with that really well. Thank you both for that presentation. I mean, that's really uplifting. Thank you. So, innovation really matters when it improves services and patient care. That's where it really gets a hit. So our next presentation, I think, Angie, He's going to show us how strategic workforce planning is making a real difference to mental health service care across Wales. So over to you, Angie.
Diolch Chair and bore da pawb, and I'm delighted to be here this morning. So yes, as Chairman says, I'm going to talk you through some of the key highlights, not all of the highlights in the Workforce Plan for Health and Social Care for Mental Health. And this came to a formal conclusion at the end of March this year. And I think it's really key to say that the plan's delivered measurable improvements for both the workforce and the people who use mental health services. And it shows through investment in workforce sustainability, multidisciplinary working, education leadership. We've strengthened the capacity and capability across Wales and consequently created better conditions for high quality person-centred care. So I'm going to highlight some achievements in each of the 4 areas that you can see on the screen. So if we move to the next slide, please. And this first theme is focused on addressing the workforce shortages that we highlighted in the plan in 2022 when we launched it. And we know that improving services for patients starts with having the right people in the right places with the right skills and support. So through increased education commissioning, investment in workforce planning capability, improved wellbeing support and better workforce data, we strengthen our ability to plan and deploy that workforce more effectively. And over the duration of the plan, we've seen additional core medical trainees recruited, we've seen increased workforce capacity across mental health services, improved retention in some of the key professional groups, and overall stronger workforce planning arrangements. But more importantly, these improvements are the things that are making a difference to people using the services. That greater workforce stability we know will support the continuity of care. It reduces service gaps. It enables people to build stronger relationships with the professionals supporting them. And better planning ultimately helps ensure services can respond more effectively to the changing population needs. We can move to the next slide, please. And this slide sort of tries to bring some of the impact to life through the voices of the people using the services and through the staff delivering care. And what these examples show is that the plan has not just simply delivered workforce activity, it's actually helped to create the conditions for better, more person-centred care. Through investment in peer support, and those are lived experience roles, psychological approaches, targeted development opportunities, staff have been able to offer support that's more relational, practical and focused on what matters to the individual. The peer support examples are particularly powerful. They show how people receiving care can feel more understood and more hopeful and more able to move forward in their daily lives. And we do have a lot of examples of that. The health professional quote also, sorry, can I move to the next slide? The health professional describes how peer support have helped promote independence and supported discharge where they previously might not have felt that was possible. And when it comes to the peer support worker, we supported each of the health boards with some peer support roles to help them to assess the feasibility for recovery colleges and also those roles of the peer lead and to undertake a recovery college feasibility exercise. And this resulted in real overwhelming support for recovery colleges and those wider lived experience roles. And this has given us an opportunity to build in partnership with our colleagues in NHS P&I a clear strategic direction for lived experience in the new model of care and meet the needs of those with mental health challenges in a very different way, a more accessible way. So if I can move to the next slide, please. So I want to talk a little bit about what we did in terms of solution-focused brief therapy. And if I can go to the next slide, sorry. Sorry, we're going back one, apologies. I'm back one more. Okay. So talking about the brief solution therapies, we've got some examples that demonstrate that similar point. So staff that have been through these developments have been able to respond differently in moments of crisis, and using these new skills to de-escalate situations and open up more constructive conversations and support people to identify their own next steps. And this is a direct illustration of how workforce development translates into patient experience, giving staff greater confidence and capability. But I'd like to just hand over to Vicky, Dr. Vicky Victoria Whitbread, who's with us this morning, just to give her personal experience to bring this to life more effectively than I can. So hand over to Vicky, please.
Yeah, I'm Vicky Whitbread. I work here as a clinical lead for the strategic workforce plan for primary care, but I also work as a GP in Ashgrove Surgery in Pontypridd. And my particular interests are patients whose care is complex. And complexity is often described as patients with multiple conditions, but in my experience, it's more about how patients and the system are able to manage those issues together. So two patients who have the same diagnoses can often need very different levels of support. And often the real challenge is helping someone take control of their health in the context of their wider life. So I completed the level 1 solution focused practice in March of this year, mainly to help me support those patients who feel stuck. And the approach encourages us to support the history that fits with a better future, using questions such as, what are your best hopes? What would life look like if those hopes were realised? What are you already doing that's helping? So to give a sense of impact and how that works in practice, I'm going to briefly describe the patient that I've been working with since completing this course. So a member of my team identified a gentleman who had not been attending for his diabetic reviews, wasn't collecting his medication, and was sending vague electronic communications to the surgery where he'd been advised to book appointments that hadn't done so. So I contacted him. It became clear that there were lots of significant issues. He had very uncontrolled diabetes, severe asthma, mental health difficulties, including agoraphobia, likely undiagnosed neurodiversity, housing problems, and unmanageable caring responsibilities for his mother. Really in my wheelhouse, pretty complex. So previous attempts to tell him what he needed to do to make things better just hadn't worked. He felt really hopeless, and he felt like the system was working against him rather than with him. So full therapy sessions through general practice appointments aren't possible, but through a series of home visits and phone calls with this gentleman, we used the solution-focused techniques to understand what mattered to him, what a better future might look like, and what small steps he was making that were already helping him. So rather than telling him all the things that he felt overwhelmed by, that he didn't feel he could do, we focused on what he was already doing, what he could do, and he made the choices to build from there. So less than 3 months later, things are still very much a work in progress, but there have been some really significant changes. He trusts me and he trusts the system more. His eczema is nearly completely healed with treatment. He's got a much better understanding of mental health, and we finally managed a formal referral for his suspected autism. He's understanding how he fits within the world better. He's moved into his own home from the first time out of his mother's home, who he was caring for. His caring responsibilities are much more manageable, having worked with the services to really pick out what he could manage, what he couldn't manage, and what other services needed to pick up on. He's walking between his home and his mother's house, which admittedly is 2 streets away, but is a really big deal for him. And he's made friends with his neighbours, which is just amazing. His diabetes is still rubbish, but he's had his monitoring, and he's up to taking his medication 3 times a week, and we're still implementing those techniques to try and get this better still. But for me, this has been one of the best learning opportunities I've had for years for my clinical work. It's been practical and realistic for me to implement, and it's been genuinely impactful, not just with this patient, but with others as well.
Thank you, and that just brings the whole purpose of why we've been doing this to life, so thank you. So if I can hand to the next slide, please, and just to pick up on the final theme, which is about creating the conditions in which people can deliver their best work through investment in leadership, supervision, well-being, and compassionate cultures. And there's some real stats on those on that slide that you'll see about the way that we have developed our emerging leaders and given opportunities through mentoring and supervision to foster those compassionate cultures in the workplace. And I think you'll agree these interventions have strengthened and promoted a more consistent approach across our services. And this matters because staff who feel supported, well-led and valued are better equipped to provide safe, compassionate and high quality care. More stable and supported teams will help improve continuity, it strengthens therapeutic relationships, and it will enhance the experience and outcomes of the people that we serve. And I guess the lasting legacy of this work is not simply the number of people trained or supported, it's the creation of healthier workplace cultures where staff can thrive and consequently the people we serve can benefit from more consistent person-centred care. And we wanted to bring in just at the end some more of the people to which this plan has made a difference. So the first two testimonials you're going to hear now are from staff and the third being from a user of the services. So thank you.
I've already received some quite significant feedback from one mentee in particular saying that in almost 17 years of her NHS practice, she has never felt as heard and listened to as she has done in some of our mentor sessions. Understandably, this was very rewarding to hear, but also it made me think more about the more broader and systemic impact that being a mentor, particularly in mental health services and in the NHS across Wales, will have.
This course has really embraced me. It has encouraged me to give me confidence to be able to become the authentic, compassionate leader that I've always wanted to be. Without the course, I don't think that I would have come as this far as I have. As it's been absolutely life-changing and career-changing. Thank you very much.
I was actually quite amazed by it, but he really quite quickly got to the root of a lot of my problems, which I found quite amazing because I think I'm quite a complex person, unfortunately. He didn't make me feel like I was doing things wrong because I'm very judgmental to myself and always quite hard on myself.
So as we go to the last slide, and some of these are quotes from people, both service users and the workforce. So I'll leave those with you. But just to say in conclusion, I think our key message is that the legacy of the plan's not only measured in post programmes or training numbers, it's actually seen in the difference made at the point of care, in people feeling supported, in staff feeling better equipped, and in services being able to offer that more timely, person-centred and recovery-focused support. The legacy of this work is a more sustainable workforce that's better able to provide the right care at the right time for the people of Wales. So as we reflect on the achievements of this plan, we're able to prepare for the significant workforce implications arising from the implementation of the Mental Health Act reforms, from a new model of mental health care, and it's put us into a really, really good position to go forward into the future. We know that delivering these new changes will also require new skills, new roles, strengthened approaches and continued investment in workforce planning and development. So our focus is now on building what's been achieved. We'll be working with Welsh Government, NHS Wales organisations, social care partners, people with lived experience and of course the wider workforce. And together we will ensure that workforce transformation continues to support the delivery of high quality, person-centred, recovery-focused care. I think that the strategic mental health workforce plan has definitely created lasting change, but maybe the greatest achievement is that it's prepared us for what comes next, ensuring that we've got a workforce ready to meet the future needs of the people of Wales. So thank you very much for your time.
Thank you, Angie. Thank you, Vicky. I don't know whether everybody could see your body language, but if everybody wants to know why people want to be GPs, look at her face. Right? When you've dealt the impossible and you make little steps possible, it gives you a buzz, doesn't it?
It really does.
Yeah.
Makes all the difference.
Not another prescription.
All right. Well, Developing the workforce means enabling professionals to work to the full extent of their skills. So the final presentation explores how independent prescribing is improving patient care while making better use of workforce expertise. So down to you, Ellen. No pressure, no pressure.
Diolch yn fawr, pnawn da, good afternoon everyone. So yeah, I'm Ellen Jones, Pharmacy Dean here at HIW, and I'm delighted to be able to share with you some of the pharmacy story. I suppose we've had significant transformation within the professions of pharmacy over the last decade, and it continues at speed so that we can really ensure that our skills and knowledge is benefiting the people of Wales. So I'm delighted to be able to share with you a little bit about how HIW and the Pharmacy Deanery is contributing to that journey. So a bit of a snapshot, first of all, of pharmacy. We have got over 3,000 registered pharmacists in Wales. Just over 50% of them are now qualified as prescribers, which is a significant shift for us and probably the most enabling skill that we have been able to add to that toolbox. We also have just shy of 2,000 pharmacy technicians who are also registered professions, and we support both professional groups within the Pharmacy Deanery as well as the wider support staff within the pharmacy team. We now have embedded over 2,300 undergraduate clinical placement weeks within the four-year pharmacy undergraduate course. And the main purpose of that is to ensure that the pharmacists of the future are ready with prescribing skills and enhanced clinical observation time. We have had 114 learners go through the Foundation Pharmacist programme. And the most significant thing for us is that these are the first cohort to come out with that prescribing skill so that they don't have to do an additional course in practice. So a real significant change, and the team here at HIW has been fundamental in ensuring that that takes place with the work for the undergraduate and the foundation training that is actually led through HIW. We have around 685 community pharmacies in Wales, and that really helps to enable us to shift care left. I think community pharmacy is one of those areas that does back the trend of the inverse care law. There are more community pharmacies in deprived areas where patients need them, and we need to make sure that we are really maximising on that. So just to give a little brief overview of some of our programmes and how they are helping to shift the care and the use of prescribing. You can go on to the next, please. As I mentioned, for the undergraduate programme that we deliver, HIW funds the clinical placements. We have had the addition of Bangor opening their School of Pharmacy, so we now have 3 schools of pharmacy that we're supporting in Wales, in Cardiff, Swansea and Bangor. And each student that undergoes those 4 years will have 11 weeks of experiential learning across different sectors. So that includes community, primary care and hospital, and also some will get an opportunity to experience things like prison and mental health and other specialist services as well. For the foundation year, which is led by HIW, that successful integration of the prescribing skill is really important for us, and we're really pleased that just last week we had the results of the registration exam, and Wales did perform higher than the national UK average, with the UK average being at just over 82% pass rate, and we had just over 90% pass rate. And so, you know, a big thank you to the foundation team. It hasn't been easy to undertake this big period of change and to ensure that learners are so supported to embed the new skill, as well as making sure that those in practice are ready to support them. So it's been a huge undertaking for the team. The next phase of this now is post-registration. We have always supported our pharmacists during post-registration foundation years. But the shift now is to support our new
cohort as prescribers, and what that means for the profession, and importantly for people in Wales, so that they can benefit from those prescribing skills right from the point of registration. So we are developing a new model of support. It's an 18-month model of support to enable those newly qualified pharmacists to embed their skills safely. For pharmacy technicians and support staff, it's really important that with the role of pharmacists shifting to being far more patient-focused, that pharmacy technicians are also developing their skills to both be patient-focused and to be able to continue with the technical aspects of pharmacy services. We're really delighted that our Access 2 programme has helped 9 of the current 61 cohort to be able to start their journey into a professional workforce as a pharmacy technician, so enabling them to gain their GCSE equivalent skills so that they can access pharmacy technician training. Our pharmacy technicians are fantastic in the way that they give back to the profession, and what's great for us is that around 98% of them continue to work in Wales. So really good for the investment of Welsh Government and HIW into their learning. So a little bit more of a focus now about how patients are really benefiting from those skills. So there are 2 key services that I wanted to just draw your attention to. As well as the prescribing service, I also want to focus on the common ailment service. So this has been a real shift for us to now have all community pharmacies in Wales offering the common ailment service, where 27 common conditions can be treated with NHS medicine and support through their community pharmacy. We have had over 556,000 common ailments service consultations within the last 12-month period, and that's grown by potentially 20% based on the previous 12 months. So a real significant shift, and my hope is that that growth continues, and what that means for the people of Wales is more access to care in a timely way, and also being able to get the treatment that they need during that point of consultation. And those patients that access this care are asked, would they have gone to another service if this service wasn't available? And over 80% say that they would have, and that's just a snapshot from March. Sometimes it's much higher than that. And generally, those people would have gone to GP practice for those services. So although GP practice continues to be just as busy, hopefully the shift is a different cohort of patients, because those common conditions are being treated in the community pharmacy setting. 2 of the mandatory aspects of this is the sore throat test and treat and the urinary tract infection service, where we are seeing significant growth in the numbers of people accessing those services in community pharmacy. So on top of that, we have just shy of 200,000 prescribing consultations happening in community pharmacy. And as I said at the beginning, we're only at around 50% of pharmacists qualified. So again, that potential for growth of services for patients will continue over the next 2 years, and HIW will be doing everything we can to support the increase, both in the number of pharmacists, but also the widening of their scope of this. And interestingly, for this cohort of patients that need the prescribing service, over 96% would have gone elsewhere, not just to GP practice, but also to urgent and emergency care. So that shift left is really being demonstrated through the community pharmacy service. For HIW, so next slide, please. Many of the courses and the e-learning that we offer is actually mandatory to enable community pharmacy to undertake those services. So the sore throat test and treat and the UTI services are 2 of those areas where there is mandatory training through HIW before you can start off at the service. So we've had 150 new completions of the sore throat test and treat and 195 new completions of UTI service. So that gives you an indication of how many new pharmacists are coming onto the register and able to provide those services. We have supported an additional 156 pharmacists to undertake their prescribing skill. So this is about those pharmacists already in the system that hadn't yet got that prescribing right because they hadn't undertaken the training. So we are ensuring that, as well as those coming through the undergraduate programme, that those already in the system are being supported to advance their skills and contribute to prescribing services. For basic life support, for all of these services, annual basic life support is necessary, and that is necessary through face-to-face completion of that programme. So over 1,400 people have completed that. And these are the other types of things that we're not focusing on today, but are absolutely crucial that we provide to enable pharmacy practice. What's really pleasing to see is that although antibiotics is one of the main things that is being prescribed in community pharmacy, actually the antibiotic stewardship is excellent within community pharmacy. And we have done a lot of work working with Cardiff University to get the stats on how often antibiotics are being prescribed and how often they're not given. And that's really important, actually, when it's not given, that the right support and advice is given, so that people feel reassured. And what we're finding is that the majority of the public are quite happy to be said, you don't need it at this point, but if things get worse, you can come back to us, and they know that open door is there, so we don't get the kickback that you may get elsewhere with people really wanting that prescription. We have worked collaboratively with the Royal College of Pharmacy to ensure that sessions are being provided to help pharmacists to expand their scope of practice. So as it stands for pharmacy professionals, we have to train in a specific scope for prescribing. And what we want is far more consistency throughout Wales, so that when patients go to a community pharmacy or even to a hospital or GP practice, that there is more consistency in the type of prescribing and advice that they're going to be getting throughout Wales. So we have provided a huge number of events in collaboration with the Royal College, and the feedback has been excellent on those. I did want to touch, there's a bit of a focus here on the community elements because of our want to shift left, but I did want to draw a little bit on how we're impacting across the service, particularly with the prescribing skills. So we've had over 5,500 people undertake e-learning modules that help with all aspects of pharmacy practice and prescribing. Just shy of 700 people have attended those face-to-face learning opportunities with the Royal College to both share their experiences of current prescribing, but also to expand and grow their knowledge. We have had learners that have completed the chronic kidney disease e-learning for primary care as well. And what we're seeing in hospital practice is pharmacists that are far more embedded within the multidisciplinary team and are able to contribute to a greater extent with their prescribing skills, both on ward rounds, but also through clinics in hospital settings. We're seeing posts coming now that are equivalent to consultant posts for pharmacists, and we're seeing those in key priority areas such as pharmacogenomics, where the prescribing in those areas are going to be far more important as these areas develop, and we need a skilled workforce that understands how to prescribe in line with the changes with pharmacogenomics, for example. It's enabling us to make better decisions and to get that transfer of care within the hospital setting right, and hopefully for that quicker discharge at the point that is required. We will continue to try and get more data on how prescribing is being used in hospital settings, and that will be enabled through more of the electronic prescribing services and the digital services that have been put in place. So the EPMA is being rolled out now across the health boards, and we are working closely with partners to ensure that we can gain from that data. In the same way, we work very closely with those practitioners that are going into GP practice. So we have got a GP transition programme, and again, prescribing is a key element of how they will be practising within the GP practice. And we have been contributing to the Welsh Government review of how pharmacists are working in general practice. Underpinning everything we do, and a key part of the training and across all areas, and this isn't just unique to pharmacy, but what we see actually across the board in HIW, is the safe, inclusive and bilingual learning that we are promoting. And one of the questions that we had at the beginning was about our supervisors, and I'm really pleased that all the supervisors that we use within pharmacy settings are given mental health first aid training. We feel that is really important so that supervisors can proactively support learners with any concerns around mental health. We encourage learners and our supervisors to speak up when they see something isn't right, and that is embedded in all our programmes. We ensure practical areas for inclusion and equality are embedded in how we produce our e-learning, our face-to-face learning, and ensure that people know that they can be their true selves when they come to learning and to work within HIW. Within the pharmacy deanery, we have had a huge shift in supporting Welsh language and bilingual education opportunities. We were really pleased to work with our partners to actually launch a Welsh language network for pharmacists and pharmacy technicians, so that we can come together and share best practice and enable people to better learn through the medium of Welsh. All of the work that we do is done in partnership. So working together is important within the pharmacy deanery as it is for the wider HIW organisation. We collaborate on a regular basis with our partners in Health Boards, Blynyddol Trust, with the Royal College, with our regulator. And it is really important that we keep on top of the changes that are happening in pharmacy. A really good example of this is through the close collaboration with our regulator. They have been looking at pharmacy technician practice and increasing the level of education for pharmacy technician from a level 3 to a level 4. But I'm delighted that through HIW, we already offer that level 4 training because we can see the direction of travel with the increasing access to care that's needed within pharmacy services. So we have already embedded that level 4 training within our programmes. For the wider sister leadership, we will continue to ensure that pharmacy is recognised and contributes to the wider multidisciplinary work that is needed for the people of Wales, and we will do that collaboratively with our partners. So a little bit of a forward view of some of the work that we will continue to do for 26-27. Next slide, please. Yeah. We will secure sustainable undergraduate placement numbers. One of the issues, I suppose, that we have got is that we do not control the numbers of students going into pharmacy training, but we do control the numbers of clinical placements. So we are now working very closely with the heads of school at Bangor, Swansea and Cardiff to ensure that that pipeline is fit for the future for Wales. We will be supporting more people to go through independent prescribing and advanced practice development so that they can both develop their own skills but further contribute to the pharmacy and wider MDT. We will implement the phase 2 of the Post-Reg Foundation practice so that we are supporting our early career practitioners to embed their skills as prescribing pharmacists. And we will develop more work for our support staff who are naturally expanding their scope. And it is really important that we focus on their key skills, not just on the professional groups within pharmacy. A key focus for us is also to improve our workforce data across all settings so that we know what the pipeline is needed and where pharmacy skills are needed for the future. And we will also be looking at our pharmacy workforce plan to ensure that it continues to be relevant and fit for the future for the people of Wales to really maximise the benefit of the pharmacy team's skills. Diolch yn fawr.
Oh. Well, thank you ever so much. That was inspiring. Can I've got no questions. So there's a bit on the end here which says closing remarks. Am I allowed to do the closing remarks with? Yeah. Okay. So the closing remarks are really everything's been said in today. Rydyn ni wedi clywed mor gymaint am y dyfodol heddiw. We've heard so much about the future. Ac mae Mrs Jones a dau bach wedi bod yn yr ystafell yma. Mrs Jones and dau bach have been in here. Because everything is focused on, yes, training and educating people and supporting people. But actually, it's about what's on the end of it for Mrs Jones and dau bach. So I think it's been a great example of how an organisation comes together, many parts, many complex, many very odd interests, and really deep understanding of minutiae. How when you put it all together, create something. So I need to thank our staff. I need to thank our staff in this building and all over Wales that make this happen, make this real. I need to thank the executive team and the chief exec for actually making sure the wheels keep rolling, and that we adopt attitudes which are hopeful and aspirational and look to the future. I need to thank the mentors, the trainers, but especially those who put themselves forward for training and education and who want to become healthcare professionals. Good on you. I'd like to thank the Royal Colleges. I'd like to thank our health board colleagues. I'd like to thank our universities and colleges. I'd like to thank our government colleagues for having the perspicacity to see a really good organisation at the top of its game, doing its best for the population of Wales. And I'd like to thank our union colleagues, because when we do things together, you actually get a shift and a shift forwards. So thank you for that. I'd like to thank my independent board members. This is not an easy gig being an independent board member, but it's an absolute pleasure. It's an absolute honour to do it. And having read through about 1,000 pages of papers today, to get to this afternoon's meeting, I'd like to thank their dedication and focus. And finally, because it's my last annual general meeting, I just want to say, going forwards, I am really hopeful, but I really think there's a list of just 3 things that I expect for the future. And that is, I want us to continue, I want this organisation to continue to use the motto, the future must pull the past. No matter what we've achieved, no matter what we do, it can always be better. And actually, if there's new stuff out there, we need to grab it and harness it so that we get more and better. The second thing is, I think the organisation should always strive to being the best of partners. It's my experience, insularity is not a clever thing. Actually, being a bit of everything is a really important function. So whether it's a catalyst or an enzyme, whether it's a bit part, I think being involved in absolutely everything and developing people in the workforce is that. I think you should always do it. It's complex, it's valuable, but it's key. And finally, you must always value people. And I think we've heard that in absolute spades today. Help people to become the best they can be, and surprisingly, they will go on and give the best of care that's possible. So NHS Wales with HEIW in it, I think has got a really wonderful opportunity to make good what the Future Generation Act aspiration is. So with that, I'll close this annual general meeting. Thank you very much, everybody. We are 5 minutes ahead of time. Thank you, Diolch. Thank you to everybody who's joined us out there. I hope it's been of some interest. And I thought those presentations were absolutely banging, as my son would say. Diolch o galon.